Well, it's my pleasure to get our final session of today started. You all have survived. I know it's been a long day, but we have a really good one to end the day with. We're going to have our second patient panel of the day. We're once again going to begin with a short presentation. Kent Perkocha, a parent of an AIH patient and a strong patient and family advocate, is going to share more about his family's experience with this disease. So Kent, we'd like to welcome you up to begin your presentation.
Well, thanks for having me. Really enjoyed today's session. My name is Kent Perkocha, and my wife Rachel back there are the parents of Caitlin, who will speak tomorrow about her experience as a patient. And today, we're going to go over our journey with her and also how you can support your patient or your child, and also involvement with support groups. Okay. So, Caitlin got diagnosed when she was 17 years old. She had a really vibrant childhood. She did ballet, she played soccer, she played basketball. That year, she had spent a semester over in New Zealand in an exchange program and come back in November and started working out with the soccer team. She was a starting goalie. And we noticed some weight loss, some yellowing of the skin, and she was itching a lot. She went to the doctor, and when she was there, she passed out, and she got some subsequent blood tests, and they wanted some more blood tests, and then they came back, and then the doctor said, well, we want to do a liver biopsy and send it to the Mayo Clinic. And we're like, whoa. Anything with the Mayo Clinic is pretty serious. It's usually some hard-to-cure disease or condition. And they said, we want to do this because we want to confirm if she has autoimmune hepatitis or not. So what are you going to do, right? You're going to do the biopsy. So we go down and meet with the doctor, and it's super scary, right? You're in there sitting with her, and there's like, we're going to take this little metal straw and insert it into your liver and take some out and then fill it back in. And it's like the gentleman just said, it's 1 out of 500, you got severe bleeding. So there is some risk. So she did the biopsy, and the results came back. It was autoimmune hepatitis. And we did all the research online, and nothing is really encouraging. Everything you read, it's not good, right? Some people respond to the drugs, some don't. Some people respond to the drugs and can get off them, very small percentage. And some need a liver transplant. So, we were pretty distressed, right? This child that you've been rearing for 17 years, and you got this mental picture on how their life's going to unfold, and that's a big roadblock, right? And there's a lot of crying involved, and Rachel and I, we had to work together and provide a unified front to best support her and how this is going to go, right? So she starts her treatment with the drugs. The first 4 months, it was pretty tricky. We're trying to explain to her younger sister, Fiona, what's happening, what's going on with Caitlin and whatnot. And there was a night in May of 2018, Rachel sent me this distress text saying, she's not responding to the drugs. I'm really worried. What are we going to do? Does this work? Okay, good. So this is the one bummer picture that was really tough for me to look at when I brought this together. But at the same time, I brought some perspective over the last 5 years with all the strength and ownership she's taken toward taking control of the condition that she's in. So anyway, Rachel sent me these texts. What are we going to do? So I sent an email to Mark Benioff. He's got the name on the hospital, UCSF Benioff Children's Hospital. And I said, I met you before. You said reach out if I ever needed anything. I thought I'd be reaching out for business purposes, but my child is not responding to treatment. Can you have someone see her at UCSF Benioff Children's Hospital? So I sent it on a Tuesday night. He responded within 20 minutes, and the people at UCSF were all over it, and we were in there 2 days later on a Thursday meeting with the head of the department. Her name was Dr. Sue Ree, and she provided immediate confidence to us as a family. She goes, Caitlin, I've got patients just like you. I've got a team of people review all the cases every Monday morning. We're going to calm your liver down. And we walked out of there that day with a lot of confidence, and we were on the road to getting stabilized lab results. That's her at UCSF that day. She's petting the animals in the poster in the background. So the next 5 years, if we look at these pictures, everything is going great. You know, she gets back on the soccer team. They win a section title. She goes to UCLA as a freshman. That's some time with the family during the pandemic. That's her with her little sister who's at school with her also. Her overseas for a semester abroad, and then graduation. That doesn't look like a person that has something wrong with them. But what happens after you get your liver levels stabilized is the reality hits. This is a lifelong condition. You don't just take a pill and it's gone. There's lots of side effects and conditions that come with this disease, and it's hard for the outsiders to really recognize this. She's got lots of issues with gastrointestinal issues. She had to have an endoscopy over in Italy. Lots of food she can't eat. She's got lots of fatigue, tiredness. She might get tired at very inopportune times. She's got lots of anxiety. Anxiety around the disease. If she's got a symptom that creeps up, does that mean I'm going to get a flare? Am I going to need a liver transplant? And there's a whole anxiety around social situations, which made it very difficult in college, which drinking is a big part of having fun. And how do you establish relationships and explain that to other people, what your condition is? You don't want the disease to identify you. So it's very difficult when your symptoms are not outwardly expressed. So for me as a parent, I needed to support her in all of these different symptoms that she has, accommodations. If she gets tired, okay. If we're going to eat something, make sure there's something available for her to eat that she won't react to. Be supportive of my wife when she gets distressed about Caitlin's condition, and also educate our support group, you know, letting the grandparents know that Caitlin's not going to be coming over eating chocolate chip cookies because it doesn't agree with her. And it's not because she doesn't love grandma or grandpa, it's just because she doesn't identify love with eating food at this point. And then our friends, you know, that this is what's going on with Caitlin, and she's going to come over after dinner because the food that we have isn't going to be something that she can eat. So for me to really understand the disease in more detail happened about 2 years ago when we got invited to join this group called A-Link. Now, A-Link is what's called the Autoimmune Liver Disease Network for Kids. It's a network consisting of 12 pediatric hospitals that have clinicians that are working together on common projects for the pursuit of AIH and PSC. These are autoimmune liver diseases. And one of the ones that I worked on with them was coming up with a common care guideline. And it was kind of interesting because all the different hospitals would present how they treat a pediatric patient with AIH, and they're not all the same. So they worked on that project, and then there's the parents and the patients that are associated with these hospitals also have their own group, and they work on projects too. So the project that we voted on as a group was to prepare a document for new patients so that when they get diagnosed with the disease, they're going to understand what's going on. So that's what we've been working on. It's not ready yet. It's in the draft form. It should be available in early next year, and if anyone wants a copy, I'll have my email address there, and I'll get it to you when it's ready. But it's got everything about the disease that you would want to know when you get diagnosed, like what it is, what the symptoms are, what the treatment's like, how do you live with it, what's the mental health situation, how do you go to school, what kind of accommodations do you need, what kind of drugs are you going to take. So working on that for the last 18 months has allowed me to really immerse into the disease and how I can best support my daughter. But my key takeaways for other parents are, you know, support your patient, support your spouse, educate your support group, your siblings, your family, and also get associated with a support group like A-Link. So if anyone has any questions, I'll take them. Also, I guess I'll sit down.
Thank you, Kent. Yeah, if you'd like to have a seat, that would be great. I'd now like to invite Rachel, Greg, and Dr. Chow up on stage for our Q&A session. Rachel, I'd love to start with you. Would you mind just introducing yourself and sharing a little bit about your connection and experience with autoimmune hepatitis?
Is that better? Okay. My name is Rachel Schmidt. I am from Michigan, and I was diagnosed with autoimmune hepatitis when I was 9 years old. So this will be 30 years. Woohoo! It's really interesting because I have a 5-year-old son, and so as I was thinking about what I was going to say today and all of this stuff, a lot of the questions were about, my childhood, and, everything that you just said about being a parent. It really just puts it in a completely different perspective. So when I'm talking about this, I just can't even imagine what my parents were going through, what you went through, what everyone's parents go through when their children at that age are, diagnosed with this really rare disease that no one has ever heard of. So for me, it was back in 1991, and I presented jaundice. I went to my pediatrician for just a checkup, and he told my parents that I had an enlarged spleen. So they started the gamut. They thought I had lupus, they thought I had Lyme disease, they thought I had leukemia, they thought I had rheumatoid arthritis. And then they finally sent me to University of Michigan, where I saw a pediatric gastroenterologist or hepatologist, and he knew immediately. He's like, classic case. So I had the biopsies, and of course it was autoimmune hepatitis. Put on a very heavy dose of steroids, and I do have cirrhosis, and then the enlarged spleen. So everything he was talking about just now about the portal hypertension, I'm like, yes, that's me. Oh my God, someone actually knows what that means. Anyway, today's been really enlightening for me to kind of be amongst these people that up until today I have never met anyone in person that has had this disease. So it's kind of amazing. So I have a 5-year-old son. He's amazing. I never knew if I'd be able to have children. So he's like my miracle baby. So thank you, Erin, for allowing me the opportunity to kind of share my story a little bit. And my husband's in here, and he's amazingly supportive too. So that's that.
Thank you, Rachel.
Yeah.
Greg, welcome to the panel. Would you like to tell us a little about you and your daughter and experience with this disease so far?
Sure. My name is Greg Van Sickle. I'm from Minneapolis, St. Paul area. My daughter, Valerie, is 15, and 3 years ago, right before the pandemic hit, she turned yellow, just out of the blue. And as I've heard here today, the diagnosis isn't necessarily a quick one. Some labs were done at the local hospital and went back home, and a couple days later we get a call, you got to get her to Children's Hospital immediately. And even there, she was there for a week, and finally, through a liver biopsy, they determined and diagnosed that she had AIH. The surprise, and I know everyone's story is a little different, she's, for the last 3 years, has been on a variety of steroids and other well-known drugs for the disease. She has cirrhosis. She had cirrhosis at the level 3 or 4 upon initial diagnosis. And now we had her at Mayo Rochester for a second opinion, and we are going down the path of transplant. So it's a interesting disease in that it doesn't necessarily always have immediate signs. My tummy hurts. What child or adults doesn't? So this has been great, as you have just mentioned, that, okay, we're all in this together, and we all have different but shared experiences here. So I look forward to the camaraderie and what I can give, get and, of course, give in her journey.
Dr. Chow, would you mind introducing yourself?
Hi, can you hear me? Right. Everybody, hi everybody, my name is Chow. I'm a pediatric hepatologist working from Riley Hospital for Children at IU. So I have been taking care of the kids who have liver disease and also who have liver transplantation as well. So I have been practicing almost like 4 years now, but from IU it's around 1 year. So I'm really excited to join you today.
Yeah, thank you. Would you mind speaking to the presentation of kids with AIH? I think you've heard a few from our panelists in terms of that presentation. Is this normal?
Yeah, I think from the previous study, we found that 1/3 of the first presentation, they can present with the cirrhosis or severe, like you mentioned before. I have a couple of patients who came to see me with low platelet, and they see many doctors, like the primary care, lupus doctors, hematologists, to make sure, and eventually they refer to see me because of the low platelet from the spleen, like the enlarged spleen. That's why they have the low platelet. So 1/3 of the kids who have severe autoimmune hepatitis, they can present with the cirrhosis or severe presentation. So it's something that not surprised me to hear about it, but it's something that if you have read before, I think in children who have autoimmune hepatitis have more severe disease compared to adulthood. So that's why we have to be cautious and we have to treat really aggressive rather than to turn to be cirrhosis and transplantation in the future. So something that we heard a lot, in children who have autoimmune hepatitis.
Thank you, Dr. Chow. Rachel, I'd like to throw a question your way. This is kind of a big one, but several decades past your initial diagnosis, how do you think your childhood was impacted by autoimmune hepatitis?
Yeah, so it's interesting because when I was thinking about these questions, I really had to think about it because it's been so long since I had an active disease. So I have not been on any sort of medication since I was in 6th grade. For those of you who have just recently been diagnosed or have children that have been diagnosed, my liver tests are completely normal. And I typically tell people that I have the liver of an alcoholic, though I've never been drunk a day in my life. So thinking about, how it impacted me as a child, no one wants to hear that their children has any sort of chronic illness at all. But from the eyes of the child, I didn't know any different. Like, I didn't know what life could have been like otherwise. I understood that I was going to doctors and, had to get blood work done, and not every child my age had to go through that. Again, as I'm a parent now, and my anxiety, I think, is so much higher now that I'm a parent because every little thing, I'm like, oh my God, is he okay? I definitely see that differently through kind of the parent's eyes. But, as a child, children are resilient and they're gonna live their lives. I went to school, I had friends, I participated in things. So in those moments as a 9-year-old, I had a really bad scare at one point. So I don't know if this is a tangent, so I apologize, but I was on a heavy dose of steroids, and one of the side effects that I actually had from prednisone, which is, I don't think, very common, is kidney stones. And so I would go to the emergency room, and they gave you Demerol, which I don't know if it's still called that, but they typically gave it to you based on how much you weighed, and because I was so heavy from the steroids, a lot of that was water weight, and for whatever reason, I had a seizure, an allergic reaction to the medication that they gave me. So I was airlifted to U of M, and at that point, they started talking about transplant. But they added then at that point 6MP, which I've heard it a couple times, but so then miraculously my liver test started to improve. But apart from, that scary ordeal where I was hospitalized for, 10 days, what have you, the day-to-day impact for me, that from what I remember, I've had lots of conversations with my parents recently about this too. To me, I didn't know any different. So I guess if that offers any help or support to families that have young children that have it, as long as you're there and navigating that with them, that's what I remember, is just going to the doctor's office and my parents being there with me during those times.
Thank you, Rachel. That's great perspective, and I'm sure reassuring to parents. Kent and Greg, I'd love to hear how you think the disease has impacted your daughters.
So Caitlin's childhood, she got it in high school, and it impacted a bunch of different ways. The hardest part really was managing the doctors, the different lab work. That was like the first thing that she had to kind of take control over and manage her health care. She was able to go back and play sports in high school, but she had difficulty kind of maintaining some of those relationships because it was hard for the kids to understand how she could look okay on the outside, but she had a condition going on the inside and she couldn't be participating in some of the social activities. So I think those were the things that were really difficult for her.
Yeah, I think for Valerie, she hasn't, aside from a certain amount of lack of energy, she's right at that age as a teenager where there's a lot of kind of late nights and sleeping in the afternoon, napping. So it's kind of hard to tell, but she's been active in softball for the last 3 years. Other activities, physical activities, is not at a lot of pain. So for her, it's more of an emotional upheaval. How does a 12, 13, 14, 15-year-old understand illness that has the ramifications that it does? I don't even understand. I'm just learning about it myself. So emotionally it's tough, and I've heard, why can't I be normal? My response to her for that is, everything in our lives affects us and builds who we are. It's easy to be negative, sad and angry. Things don't do any good. So how to help your child, your loved one, maintain optimism is a challenge, but it's one we all have to make to move this in the right direction.
Thank you, Greg. Dr. Chow, I'd love to get some perspective from you when you see autoimmune hepatitis patients in your clinic and their families. What are they mostly talking about? What concerns are they bringing up? Is it like physical concerns with, side effects from medication or symptoms of the disease, or is it things like maintaining friendships, participating in activities in school?
I think all of both that you mentioned. I think many family always, it's a chronic condition. So they always has many questions since like how the outcome, how they can look like in the future, about the side effect of medication. So I think they all have the good questions at the first time clinic. So most of the time the first visit, we try to sit down and try to go through the whole characteristic or natural history of the disease, try to make sure the patient or the family understand the disease. And one important thing that I noticed all the family always worry about, your kids gonna doing okay or not, right? That's a tough question. I cannot have any crystal ball that I can tell you that this one gonna be respond really well with the steroid, and we can stop steroid really quickly. You know, we have no test to tell you guys, but I think we try our best. You know, we work together between family and the healthcare provider, try to go through together, try to start the medication as soon as possible and try to wean as soon as possible as well. And in the meantime, that you mentioned about the mental health or other condition that you mentioned about the anxiety or the kids, teenager who have chronic condition, I always recommend the family try to notice, try to make sure the kids doing okay, because when the kids have those issues, they don't talk to us that much, right? And then they might not take medications. And when you don't take medication, of course, they're gonna lead to more liver damage and more complication. So I feel like it's very important that we have to work together, that the family and healthcare provider, if the family concern or some kids have some concern, we should help each other. You know, like sometimes I always talk to we have the ped psychologist, you know, they might help the teenager to cope with the chronic condition, how to make a better compliance, you know, with the medication, those things. So we have many resources for the family to help. So don't hesitate to call us or ask any question if you have any question or concern. Okay. All right.
Thank you, Dr. Chow. Rachel, I'd like to throw another question your way. I'm just wondering, kind of thinking back on your childhood, is there anything your parents did to support you as a kid with autoimmune hepatitis that you found especially helpful, or something that you think other parents could think about, other parents with kids with this disease could consider?
Yeah, I mean, I truly think that, this wasn't just my journey, it was my family's journey. Having to adjust my diet and not being able to have a lot of sodium and those types of things. It wasn't just a me thing, like my whole family embraced that. I wasn't able to do a lot of contact sports because of my spleen and the risk of rupturing my spleen and those types of things. So we didn't go on ski trips. We didn't do things that I wouldn't have been able to participate in. So I think, thinking back on that, just they never made it seem like what I was going through wasn't okay. It was just part of our lives, and they navigated it as though it was just something that we had to deal with. And I don't remember ever feeling, from that perspective, left out as far as my family goes. And again, I already said this, but thinking about it now as a parent, I just wonder what my parents were thinking about having to, navigate this, or if they were just, rolling with it. But yeah, I mean, I guess that was kind of my takeaway, is I never felt like isolated. I always felt like, it was all of our journey, so.
Thank you. Kent, I'd love to hear from you. Are there any strategies that you and your wife have taken on to help support Caitlin that you think have been particularly helpful?
At the beginning, not as much. I think over time, the key thing for us really was when we got to talk to other people that were parents that had children that had the disease, and that wasn't until at least a year into it. And then a lot of light bulbs went off in our heads about how this is going to unfold and how we're going to be best to support her. Talking to the other parents, I mean, we'd have a meeting in this ailing group like every month, and everyone would talk about what's going on with their kids, how they're dealing with school, how they're dealing with college, those sorts of things. And that gave us a lot of ideas on how to support them. To support Caitlin. The key thing that I'd say is as you're going through this is don't get stressed out, because any stress that we have is going to be multiplied when it gets to the patient. I mean, my takeaways are find a support group, find other people that have it, because that's super calming. And it was good for Caitlin too, because she didn't talk to someone until a year after she had been diagnosed, because we were kind of out there in the wilderness, not really understanding how the disease was going to play out and how you live with it.
Thank you. Greg, what about you? Is there anything that you've done and with Valerie that you think has been a big help to her as she works through this disease?
Well, there's sort of a disbelief, and especially if you haven't had other illnesses in your family or in your circle, you're kind of struck instantly by the diagnosis. And then they say, well, it's treatable, and you go on medications, and time goes by, and there's lab work, and you come back, and well, these numbers still aren't right. There's gaps in time where if there isn't a visual manifestation of the illness, it's easy to not focus on it. And I say this out of honesty. It's easy to kind of just sidestep it almost. And while I'm sure the doctors know what's going on, or it's easy to miss some certain things, to miss opportunities for the questions. So I would encourage the parent, caregiver, to understand quickly the seriousness of the disease, and to advocate for your child to get those answers, which may not necessarily be your first default action.
That's great perspective. Thank you. There's one more topic I want to cover before we open it up to audience questions. I think I'll start with Rachel again. I'm curious about your transition from pediatric care to adult care, and that's something we hear from a lot of pediatric families. They're like, oh, when should my child switch to an adult hepatologist? What was the process like for you, assuming responsibility for your own care and making that switch to an adult hepatologist?
Yeah, I was lucky in the sense that I honestly don't remember ever going to any appointment by myself, and I'm 38 years old, and I've gone to a lot. So even when, I had the opportunity to kind of take ownership of some of my care and kind of be the person that they reached out to, my mother always came with me, whether it was just a checkup, whether I've had to get a lot of EGDs, ultrasounds, MRIs, all the things. So, kind of going back to the last question, it wasn't just my journey, it was my parents too. But the one thing I would say, and it's been said in so many of these presentations today, is advocate. If the most daunting thing for me was realizing how overwhelming hospital systems are, especially if you're seeing multiple specialists like hematologists and hepatologists and gastroenterologists and your primary care physician, and making sure they talk to one another, which isn't always, they just don't have the time for that, right? So I'm kind of that middleman. And so just taking ownership of that, and your body and your health better than anybody else, better than your parents, better than your caretakers. It's your body, and when something's off, or if something feels wrong. I totally resonated when you said that your daughter was like, oh my gosh, what's that? That feels different. Is it a symptom? I'm freaking out because that anxiety is real. So, having your people that you trust in the medical space, whether it's your specialist, your primary care doctor, getting a therapist, having a therapist to talk to you about this anxiety, the health anxiety. Up until COVID, I didn't realize it was a thing. COVID hit, and I found this organization, thank God, because I thought I was gonna die. Because we're all, immunocompressed, or sorry, I can't talk, but immunocompromised. So it's scary. It was very scary. And so what does that look like for us? What does that look like, moving forward and those types of things? So having that support system and just, being able to be outspoken and advocate for yourself and do the best you can to navigate your health system in whatever way possible, because as much as you wish that the doctors talk to one another, they just can't all the time. So you have to, do the due diligence of that. So.
Thank you. Kent, how have you kind of navigated the process of, transitioning to Caitlin kind of taking more ownership of her healthcare?
Well, she'll talk a lot about it in more detail tomorrow, but she owns her healthcare. She owns orchestrating all the different doctors and all the different lab work, and it's been great for me because it's helped me out in my healthcare, and we trade a bunch of different healthcare strategies outside of normal traditional medicine, meditation, breathing strategies, yoga. Nutrition supplements, stuff like that. But I'm very impressed and proud of how she's handled it, and I know that what she's doing, she's going to get the best possible outcome through her actions.
Thank you. Oh, Caitlin, do you? Yeah, I can jump here. Okay, great.
Just quickly. So I was diagnosed when I was 17, and when I was 16, my parents made the decision that I was in charge of scheduling all my appointments for doctors and stuff. So from day one, I've been in charge of it. And they've been there coming to appointments and setting me up with UCSF, but for the most part, I handled all of that stuff.
That's great. Craig, I imagine you might not be quite there with Valerie because she's only 15, but have you started thinking about that process at all?
We have. It's tricky to know, at 15. Of course, maturity has a big part of that, and she's kind of right in that age between little girl and young woman. And just on the phone a night or two with the transplant coordinator, Valerie asked from the background in the phone conversation if they would do the transplant while she was awake. And then she quickly came back with, well, they do brain surgeries when people are awake. So, and it's something that we will be helped with by the counselors and doctors, the team at Mayo, as far as what is appropriate level of her involvement, engagement, knowledge, understanding. I'm not sure. Yet to be determined, but we'll flush that out.
You'll have to give us an update in another year at our next conference. I'd like to end with opening it up to the audience. Does anyone in the audience have questions for any of our panelists?
So I'm an AIH patient, but I also used to work for a children's hospital in Baltimore, Kennedy Krieger Institute. One thing I encounter, because I used to do patient access, which is the person who checks your insurance, as soon as that child turns 18, the parent is cut out, and by law, by HIPAA, I couldn't speak to the parents, so I'd have parents calling me, the day after their birthday, like, oh, I need to, schedule this, or want to know about results, and they were kind of taken aback, because I was like, sorry, I can't talk to you anymore. I need the child to, or the now adult has to speak to me. So I'd say my biggest recommendation is for, I guess, any parents of pediatric patients to set up, once they hit 17, start setting up either for the person to prepare for that transition between 17 and 18, whether it's getting their consent to add you as an authorized person on their guarantor account, or something like that, and that really helps smooth the transition, because there were some bumps I had to deal with, like, I really can't talk to you, I have to speak to the child, and then the child has to then authorize me to speak to you. And I know if in the run-up to turning 18, it's a lot smoother if you get that paperwork put in place beforehand.
Thank you. Other questions?
Maybe it can help to add more that comment or question. I think right now, if you talk about transitioning the patient from pediatrics to adult, one checklist that we always ask right now is insurance. It's really important point that sometimes they don't know. I think our many centers, they try to help family to find the insurance in the future. Like, you have to let them know that when you turn 18, the family insurance may not cover for you anymore. So what should we do next? So something that's really important, and we always in the checklist right now for when they turn to be the adult doctor. Yeah.
Thank you.
Mine is not a question. Mine is just a statement of having someone for support is very, very important. Whether it's your spouse or your parent. I don't think I could have walked this journey or, continue with this journey without the support of my family, especially my sidekick back here, my mom. She's always there to support me. She always has the good questions when I can't think, with the medicine, you have that brain fog and everything. And my mother always, she has the questions for me. And even if they're outlandish, she'll ask them anyway. So, yeah, just, having that support is just so very important.
Thanks, Aricia. I think that's a great sentiment to close on. Thank you all to our panelists and Dr. Chow for being part of the panel, especially. Any other announcements? Dr.
Yeah, I just
Boomer?
want to say thank you to the presenters today. I think Ethan and Michelle will be here tomorrow. We'll have a whole new slew of presenters coming from other centers, but also here at IU. Thank you for all the panelists that participated. I think this makes us really special. Special thanks to Kazar as well, Life Science, for the presenting sponsorship, and Perspectum, who's also here. This was a long day, and I hope you found something that you can take with you. Get some relaxation time in tonight. Consider coming to the Hampton Inn. That would be great. We'd love to see you. But come back for some more tomorrow. So thank you all. I appreciate it.